Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, drug of choice for therapies. So, in the drug of choice for actually partial seizures, for partial seizures or secondary generalized tonic-clonic seizures, for partial seizures or secondary generalized clonic seizures, first line is we can use carbamazepine or phenytoin can be used as first line, whereas second line is we can use valproate. Okay, sorry. For partial seizures, only for partial seizures, the first line drug is carbamazepine and phenytoin. Second line drug is valproate and phenobarbital can be used. Okay, this is for partial seizures. Then, after partial seizures, we have absence seizures. For absence seizures, first line agent for absence seizures is actually valproate and ethosuximide. Nowadays, we use ethosuximide for the absence seizures also. Then the alternative for absence seizures is lamotrigine can be used. Alternative is lamotrigine can be used. Then we have myoclonic seizures. Myoclonic seizures. In myoclonic seizures, the drug of choice for myoclonic seizures is valproate. Alternatives which can be used are zonisamide, levetiracetam are used. Then the febrile seizures. For febrile seizures, the drug of choice for febrile seizures is actually rectal diazepam is the drug of choice for febrile seizures. Then we have infantile spasms. For infantile spasms, the drug of choice for infantile spasms is adrenocorticotropic hormone. Then we also have in the drug of choice for infantile spasms which are associated with tuberous sclerosis is actually vigabatrin. Okay, next we have Lennox-Gastaut syndrome. Lennox-Gastaut syndrome. For Lennox-Gastaut syndrome, we can use lamotrigine can be used for Lennox-Gastaut syndrome, and you can also use topiramate for Lennox-Gastaut syndrome. Then, for juvenile myoclonic epilepsy. For juvenile myoclonic epilepsy, the drug of choice for juvenile myoclonic epilepsy is actually valproate is the drug of choice for juvenile myoclonic epilepsy. Other drugs like lamotrigine and topiramate can also be given. And one more important thing is in juvenile myoclonic epilepsy, what is contraindicated? Phenytoin. Drugs like phenytoin and carbamazepine are actually contraindicated. Then epilepsy in pregnancy. Epilepsy in pregnancy, there is no definitive treatment for epilepsy in pregnancy. It is based on the choice of the patient and also the risk versus benefit ratio. Risk versus benefit ratio is considered before giving treatment to epilepsy in pregnancy, but the best thing is continue the same drug if the patient is already on any of the anti-epileptics, then it is better to continue the same drug. Or the safest anti-epileptic drug in pregnancy is actually levetiracetam.
thank you and thank you for watching.